Everyone who is joining us today. My name is Catherine Dougal, and I am the Development and Engagement Specialist here at Bridge, Michigan. Today, we are discussing the impacts of COVID-19 on higher education this fall and beyond. So this event is a part of Bridge, Michigan's monthly lunch break series, where we discuss policy issues important to Michigan residents. If you aren't familiar with Bridge, Michigan, we are a nonprofit, nonpartisan statewide news organization. You can read our coverage every day for free online at bridgemi.com. I want to thank our Bridge members who are with us today and who help support our work. If you are not already a member and would like to become one, you can do so anytime on our website, and our membership director, Amber DeLind, is going to drop a link in the chat for you. The schedule for today's discussion is that we'll begin with a conversation between Bridge, Michigan senior writer Ron French and our two special guests, who I'll be introducing in a moment. We'll then open the discussion to reader questions at the end. Throughout the discussion, you can enter your questions into the chat at any time. And if you're calling in today, you can email your questions to us at membership@bridgemi.com. Just so you know, we are recording this conversation. So if you have to step out, that's fine. We'll be posting it tomorrow on Bridge, Michigan's website. Now to introduce our special guests. First, we have Maddy Day. Maddy has spent the last 12 years of her career focused on improving education outcomes for students with experience in foster care, first through founding the University of Washington Champions program, and then through developing and directing Fostering Success Michigan. Maddy is now a child welfare and education consultant supporting the Annie E. Casey Foundation's Jim Casey Youth Opportunities Initiative. Maddy is the owner of Maddy Day LLC and Associates, a consulting firm focused on systems reform, and currently serves as the chair for the Michigan College Access Network Board of Directors and chair of the Kalamazoo DHHS Board. We are also joined today by Dr. Ora Hirsch Pescovitz, president of Oakland University. Dr. Pescovitz is a renowned leader in higher education and has an international reputation as a healthcare executive, pediatric endocrinologist, and researcher who has published more than 190 papers and books. Prior to her role at OU, Dr. Pescovitz's work includes 21 years at Indiana University, including serving as Executive Associate Dean for Research Affairs at the IU School of Medicine, President and CEO of Riley Hospital for Children, and Interim VP for Research Administration for IU. Dr. Pescovitz was also the University of Michigan's first female executive VP for Medical Affairs and Health System CEO, and was the Eli Lilly and Company's Senior VP and US Medical Leader for Lilly Biomedicines. Dr. Pescovitz earned her medical degree from Northwestern University's Feinberg School of Medicine and serves on an incredibly long list of boards and committees, including her role as a member of Governor Whitmer's Michigan Economic Recovery Council. Heads up to our audience today, Dr. Pescovitz is experiencing some technical difficulties with Zoom, so she's going to be joining us via audio only. I'm now going to pass it over to Bridge senior writer Ron French to kick us off.
Thank you very much, Catherine, and I want to say it's just a real thrill to be here with Dr. Pescovitz and Maddy Day, true experts in the field of higher education. I think everyone's in for a treat today. Higher education is always an important and challenging topic in Michigan. In particular, Michigan has below the national average in number of percent of adults that have a college degree. That sort of often holds us back economically. There are large scale efforts, both at state and at institution levels, to try to turn those numbers around. And then you layer on top of that this crazy year we've had, where everything becomes much more difficult. And so we're hoping to try to talk about some of the issues that coronavirus has caused for both the institutions themselves and for students. So if I could, I'd like to start with Dr. Pescovitz a little bit and just talk for our readers here a little bit about how the pandemic has affected Oakland University.
Well, thank you. I want to thank Bridge Magazine for inviting me to be here, and I'm delighted to be on the panel with Maddy and Ron. Thank you for inviting us. Well, certainly the pandemic has impacted Oakland University as it's impacted every institution of higher education, both four-year institutions and community colleges, very significantly. And, you know, I think it's really remarkable when we think about the fact that over the course of a single weekend in March of 2020, we all transitioned like almost on a dime. We pivoted from being face-to-face in education to going completely to essentially what was online education. And that conversion was really remarkable. We did that at Oakland University, but really almost every university in Michigan and across the country did the same thing. And what it really demonstrated was that we had the capacity to be so much more agile and resistant than and resilient than anyone ever imagined that we could be. And that's true for our students, that's true for our faculty, and that's true for our staff. So, you know, people have a lot more capacity than you realize that any of us have. It meant that we had to transition not only our classes, but all of our student services, academic advising, tutoring, career services, counseling, and health services, all to a remote format. And that meant expanding technology capacity to handle the use of this increased and changing environment. But the impact on the university was really enormous. And what that meant was that there were so many things that had to transition. And so over the course of the last more than a year, it impacted every single thing that universities do. And it was unimaginable when you think about it. It didn't just happen over the course of that weekend, but everything that happens at a university, from academics to athletics to finances to employees. So there really isn't a single thing that didn't take place in a new way. Oakland was the first university in Michigan that announced that we would be moving to a hybrid format in the spring of 2020. And that allowed us to, when we started to think about what we would be doing differently, begin to realize that we could actually, shortly after that weekend transition, be able to go to a format that allowed our students to have social distancing, mask wearing, and attention to other hygiene protocols, be able to see students in a different format, but be able to offer academic opportunities in that manner. And it really was an extraordinary transition that really gave us choice that was really exceptional. But everything else changed. So for example, residential students, the number of students in the residence halls decreased significantly, and that had a huge impact. And so what it meant was that the revenue that came into the institution declined, the expenses increased, and yet the experience was not the same. And it really was very significant. The impact on technology, though, all of a sudden became so much more significant because we recognized that we couldn't make it without technology. And so that was all of a sudden so much more important. The impact on food became a whole new experience. And so there were so many things. There isn't a single thing that we did in our lives that wasn't impacted.
Yeah, what an incredible logistical nightmare it must be, and you all that have survived will be better for it. I don't know if you're all going to survive, but thank you so much. One thing that I'd love to follow up quickly with you, Dr. Pescovitz, is just talking a little bit about the students themselves.
Right.
Yeah, I just.
But when you take a deeper dive, you can see that there is an impact. When I say they've fared very well, they have, most of the students that were enrolled, either those that were enrolled to graduate in December, graduated, those that are going to dramatically increased, and we have actually increased our mental health services very significantly for our students as well. And it's taken a toll in a lot of other ways as well. Students who are disadvantaged in particular, these students have required a significant amount of extra wraparound services. So that includes students who use our advising, students who use our counseling services, students who need food, and students who need extra support. Those students who are on the border to start with, they need even more extra support. And even things like technology, if you think about it, we give students, we've had to get students extra computers because the computer and technology needs increased so much and so dramatically. So the student needs were dramatically increased. But one of the things that I think is really interesting is that in spite of this enormous impact on the entire university community, students, faculty, and staff, is that the resilience was so incredible and the impact was so dramatic, but every component of our community recognized that as difficult as it was, the impact on us was less than it was on our surrounding community. So as an example, we are near Pontiac, and we have a partnership between Oakland University and Pontiac. And one of the ways that we recognized that we could feel better about how we were doing was by reaching out to the Pontiac community. And students, faculty, and staff engaged, and I will answer this a little bit more later when we talk about other things that we did in our community, by helping others. And this altruistic approach that we had at the peak of the COVID crisis in our community really enabled people to recognize how much worse others had it than we did. And that really enabled people to thrive.
Thank you. When you talk about some of the challenges faced by all students, and in particularly, you know, some of the students who may be economically disadvantaged or first generation, maybe they have more challenges through this. Maddy, Day, that's something that an area that you work in. Can you talk a little bit about sort of what sort of trends there are that you're seeing either state or nationally, and both in enrollment, and if there's anything you know about particular groups of students, how they're being impacted on whether they're going to college or not?
Yeah, absolutely. Thank you so much, Ron. I will do my best to weigh the unfortunate news with some bright spots, because I think it's really important that we recognize some of those bright spots as well. But what we're seeing nationally is about a 10% decline in enrollment at our community colleges, which for those of us who work, and really focused on our first generation low income students, students who I work with, students who are system involved, that's a large concern. Interestingly, we've also seen about a 5% increase in enrollment at our private for-profit institutions, which, for a variety of reasons kind of raises some eyebrows, particularly for those of us who are looking at work with system involved students who are often targeted for some of the more predatory practices by some private for-profit institutions. when we look at the types of students and how they're faring, of course, we've seen a decline across the board for all students in enrollment. We've seen the steepest declines for our African American, Latinx, and Native American students. And we've seen that particularly sharp at our community colleges. And so it's something that we're very concerned about. I know, Ron, in a recent conversation you and I had, we're also seeing that decline show up for our low-income students across the board. When you think about, and this goes to what Mrs. Pescovitz was saying, when you think about some of the challenges that our students have who are coming from backgrounds that traditionally have less access, you're talking about students that have less social mobility, less social capital, and that security net, I always say is much more like Swiss cheese for those students. There's lots of holes in that security net for our low-income students, our system-involved students. And what we found was that very quickly, as sort of the beginning of the COVID pandemic, set on, those students didn't have a place to turn. It wasn't easy for those students to simply, go back home when you don't have a home or you don't have caregivers who can help you navigate where a safe place to live is when, colleges are shutting down. Now, I said I would talk about some bright spots. I think we saw some of our campuses, particularly campuses here in Michigan, that have specialized programming for students with experience in foster care, students who experience homelessness, and other students who are otherwise disconnected, really rally around our populations of students and really work very closely with social services to ensure that these students, weren't left behind, weren't literally left out in the cold when that, quite honestly, was the case for some of them as the shutdown was so rapid. And so I really want to commend that work. I think we also see some of our community colleges here, West Shore Community College and Grand Rapids Community College, stand out as particular examples where they have really leaned into understanding the holistic needs of students and looking at the significant increase in food insecurity, the challenges around transportation and childcare, and understanding that as post-secondary institutions, they are able and quite honestly equipped and poised to do much more than academic education, but really fill some of those nurture gaps that some of our least connected students have when they step foot on a college campus. I also think it's important to recognize we have some amazing tribal colleges here in Michigan. And those tribal colleges, particularly the Saginaw Chippewa Tribal College and the Keweenaw Ojibwa Community College, have really stepped up to reach out and engage their communities and ensure that our Native American students are not falling behind. And I think that that's something that, as we consider students who are falling out of the education to career pipeline, we need to acknowledge the significant role that here in Michigan, our tribal colleges play in helping some of those students stay in and stay connected.
Thank you. I was sorry, I was writing it down. So for a story, I'd love to talk to you more and talk more about tribal colleges. I'd love to ask this to both of you, but Maddy, if I could stick with you to start. When you talk about some of the efforts that are being made this year to help those students, what is your impression as to whether this is a one-year effort, or do you think that some of these efforts that are being made now to try to address some of the issues might stick around post-COVID?
Yeah, I think that the efforts that we saw, particularly the work around food insecurity and having really focused campus support programs and outreach efforts around childcare, those were all underway. But, I always kind of say there was sort of this underground network of advocates who are working to support students. I would always say on a college campus, I know who those students were, but other people might not, right? And so I think that we've actually brought those resources and really the needs to the forefront. And I think that universities and colleges are recognizing that it is not a select few students that have these needs. It's actually a significant number of students that have these needs. And I think that these support services and the integration with community support services, I think that that's here to stay. And I think that we will be for the better of it.
Dr. Pescovitz?
Yes, and I agree with Maddy. At a place like Oakland, for example, and I think people in the general community are not aware of this, but a third of our students are first generation students, and a third of them are Pell Grant recipients. So just to give you a sense of, how many students could potentially be in the category that Maddy's talking about. That's not to say that a third of our students are food insecure, but it could be a very significant number. And we have, for example, a place that students can go to a food pantry. They can also go and get clothing as well. And we actually, at a place like Oakland, even have some students that sleep in their cars. So it's hard to believe that that is happening today at college campuses, but it is happening. And it's not because of the pandemic. It may have been made worse during this past year, but it predates the pandemic. So I want to just agree with what Maddy has just said. It is a problem that we have in America. We have poverty, and poverty is a real problem that we have to face. And it's been brought to the fore. As a matter of fact, I think the president's program that was announced last night to, for example, double the Pell is actually in part, I don't want to really address the details of that, but one component of it that doubles the Pell would actually be a very helpful thing. So that is important, and it is real. At Oakland, for example, diversity, equity, and inclusion is one of our strategic goals because it does enable us to broaden one of the things that we are focused on as, in general, part of our mission, vision, values, and goals. And students from historically underrepresented groups and first-generation college students and low-income students have actually found it more difficult to adapt to college life. And again, one of the problems with the pandemic is that because they were already somewhat disadvantaged, it pushed them more over the edge. But we were working very, very hard to provide them with these extra support services, mentoring and counseling, and additional programs. We have 3 programs that I just would mention as examples of the kinds of things that we offer. We have a program called a core program. We have a circle of brotherhood and a circle of sisterhood. These are support programs that we offer in addition to the kinds of things that Maddy talked about, food programs, and I mentioned a clothing program, things like that. And also social programs and networking programs and student groups that are really very helpful too. But I do think there's an opportunity for higher education to do a lot more to integrate contingency planning more systematically. We're just touching the tip of the iceberg here.
Sure, absolutely. Let's talk about something that's in the news here fairly recently. When Governor Whitmer was announcing today that different goals she has for percent of adults 16 and over who have been vaccinated, and using that as a way to start opening up the state more. And obviously one of the populations that has a lower rate of vaccinations right now are the age 16, 18 and college students. And so if I could, I'd just love to talk to Dr. Pescovitz for a second. Just what can you talk to our readers about what are the efforts on your campus to offer students the opportunity to get vaccinations, and what's been the response?
Well, a couple of weeks ago, when we were offered a vaccine from a number of different sources, partly from the state, partly from the county, and partly from others, including, for example, Rite Aid and others. We had, over the course of our first week, we got 5,200 vaccines offered to us in 1 week period of time. When we made the announcement, within the first 5 hours of making the announcement to our faculty, staff, and students, we had over 1,000 people register.
Wow.
So the response was absolutely overwhelming and dramatic. We were oversubscribed right away. We have just opened up our second tranche of vaccines that have just come in, and the positive response is really extraordinary. So I am thrilled with that, because as a university president and as a pediatrician and as a physician, I can just say, and I'd like to say to the listening audience, participating audience, that the single best path to getting past this pandemic is for everyone to get vaccinated as quickly as possible. And the data clearly show that in the over 60 age group, the rate of infection is rapidly declining because of vaccination alone. So I strongly recommend that we all quickly get vaccinated as soon as we can. And that is happening on our campus. In addition to offering it to everyone and encouraging everyone, both on our university campus and the community as a whole, we have made it quite clear that in order to live in our residence halls this fall at Oakland University, and I should just mention that only 20% of our students are residential students, 80% of our students are commuters. We are going to require that students living in our residence halls be vaccinated. And the reason for that is because that people living in close quarters are the ones who are most likely to pass on the infection, both to one another, but also to the community at large and to more vulnerable populations. And we want life to return to normal on our campus as quickly as possible. And I want to be able to have as close to a pre-pandemic campus at Oakland University this fall. I want the fall of 2021 to look like the fall of 2019, not like the fall of 2020. And the path to that is vaccination. And so that's why we've mandated it for students living in residence halls, with the exceptions being, of course, medical and religious exemptions. If students choose not to be vaccinated, they may live off campus.
Sure, thank you. Obviously, this past year at Oakland and almost all of the universities, a lot of classes, if not all classes, were virtual. And I wanted to ask Maddy Day, I was curious, I didn't know if this would be a positive or a negative for some of the harder to reach populations that you're trying to get access to. The fact that maybe they don't have to travel and so they can do it at their kitchen table, more of these classes, maybe because they don't have transportation or they have family care. Or is it more it hurts the chances of someone enrolling because they don't have access to the technology? What's your thought on that?
Yeah, the access to technology piece has been, to say significant just feels even not enough. It's just been a huge issue for our students, and I think has really brought to the forefront just how significant the technology gaps are in our state, in our country. And so, unfortunately, we've seen a lot of students who really relied on their accessibility to campus to participate in education. And you think about all the resources that are just inherent on a campus, right? Some of those practical things like a food or basic needs pantry that they can easily access and really access without a lot of stigma, to mental health services that, as Dr. Pescovitz has said, are just increasingly necessary and important for our students. And also the people, for our students who are really most vulnerable, our first generation students, or students who are disconnected in many ways, they're often coming from places, from communities where participation in higher education is not maybe understood, is not the norm. And as we know, as anybody who's participated in higher education, there are unwritten rules, right, about higher education and how we move through it that, often can't be answered by just, your average person that hasn't experienced it. And so the not being able to be on campus in person, that lack of proximity to support has been very significant for our students. And, even over a year in, when I talk to my colleagues across the state and across the country, they're still struggling, particularly with that technology piece. It's one thing to say, here's a hotspot, but then, it needs to be reliable. You need to have, as we all know, Zoom capability, which is not just any old internet anymore. You also need to have the right equipment. You also need to have a space that is safe, where you can sit and pay attention to your work and pay attention to the lectures that are happening. And many of our students don't have that. As Dr. Pescovitz said, many students are sleeping in their cars and, without access to things like being able to go to libraries or community centers, because of course those are now, many of them are closed or open at limited capacity because of COVID. We have students in very precarious situations that don't lend themselves to learning. And, those are, I think, really some of the barriers. Now, of course, there are some advantages to not having to maybe do the long commute, but when I look at those and when I talk with students in the real world, I don't think that any student who's also a parent has said that, oh, it's easier because I don't have to have childcare. Even for those of us at home, having little ones in the background does not make it easier, right? And so those are real barriers for our students persisting.
Well, thank you, Maddy. And I want to stick with you for a second. You talked about, good internet access and the challenges that are involved there, particularly probably in some rural areas. But I was wondering, because it seems like one of those subjects that has always sort of been percolating there, but really because of the pandemic, now it's become apparent for everyone. You mentioned this. Would that be your top thing? If you were trying to look at one thing from the sort of work that you do that says this is a subject now that has come to surface and people know we have to address, would that be it, or do you have anything else in mind?
Oh gosh, I mean, you're really asking like if I could wave a magic wand, but
yeah,
I think so I do think reliable internet would be something that would not just be something that's necessary for the students that I'm particularly connected with, but it would be for all students, right? I mean, it would sort of raise the water on all boats. And it's really not just a rural issue. We see this issue in our very dense urban populations as well. And so, that would be something that I would really encourage our policymakers to look at and make strides toward. And I really think that there's a lot that we can do, and I think that we can do it. It's not something that is unattainable. It seems like something that is very attainable, and we have the ability to build that infrastructure should we want to, right? I think beyond that, of course, I have to put a plug in there for the college access work that we have here in Michigan, led by the Michigan College Access Network. I think that there's more opportunity for us to continue to deepen our engagement around college access, I would say across the state and within our communities. I've always felt like if we could invest in creating a college access movement in the way that we create public health movements, I really think that we would see an increase in our talent pipeline. And, for years, it's like I moved to Michigan 9 years ago and was just so incredibly impressed at how this college access, movement was rolling, but yet there still seems to be pockets where we haven't quite hit, and populations that maybe we haven't brought along with us. And I think if we do a really whole scale public health style campaign and make going to college and getting a credential, maybe a 4-year degree isn't for everybody, but a credential is. A certificate or a credential absolutely is for everybody. And I think just like we asked during, Breast Cancer Awareness Month, would you donate to, Breast Cancer Awareness Month? We should be asking during October, have you filled out your FAFSA? At every grocery store checkout, at every place that we're seeing somebody, it should just be that normal that we are encouraging everybody to reach for that credential and really use the support that we have here in our state. Again, you asked for the magic wand, so
I love
gave
it.
it to you.
Well, I want to echo what Maddy's saying, because we do know, and frankly, I want to push it just even a little bit higher, because we do know that 38 of the 50 hottest jobs in Michigan do actually require a 4-year bachelor's degree. And so if we do care about not just we've been talking about the health of our citizens, but actually the health of our economy, that we actually do need college degrees for our citizens. So it really is an important effort. And so I completely agree, and I applaud the work of the Michigan College Access Network, because it is really essential. And I love the idea of if you say, use the month to say, did you fill out your FAFSA? Because it is a critical component of getting us to where we need to get to. So I just wanted to weigh in on it too, even though you didn't ask me. But
I was heading that way.
Yeah.
Yeah, I want to follow up with you, Dr. Pescovitz. At some point, this is going to be over. I don't know when, but at some point, we're going to get back to what something that resembles normal. Looking at your campus, and I'm sure you talk to your colleagues at other institutions all the time, I suspect there must be some things that are probably going to be permanent changes from this. Maybe it's more online classes that has really worked. So maybe that opens up the possibility of doing more of those. Can you name a few that you're looking at and say, I think that probably we may continue to do X, Y, or Z?
Well, and I do see a question in the chat, and I may address it while I'm answering it, because I want to make sure we get to it. I see that somebody is asking about test optional, and they're referring specifically to ACT and SAT. So let me maybe start with that, just to make sure that we're addressing that. So Oakland, and there are several other universities in Michigan that I know are doing the same. We actually had made ACT and SAT test requirements, test optional just prior to the pandemic. So we didn't do that specifically because of the pandemic. And the reason for it, so that's an example of one, but it was just prior to the pandemic. We did it because the data actually suggests that those tests are not that predictive of how a student will perform in college, and that the best predictor is actually GPA. Now, I will say that it is somewhat controversial. There are still some controversies about whether you can actually use GPA alone, and whether there might be some other things that we might need. And maybe one day we'll go back to something else in addition to GPA. But I will say that as we're coming hopefully out of the pandemic and light is at the end of the tunnel here, we are not planning to go back to testing. So that's an example of something. But there are probably some other things, and I think you're probably referring to whether we're going to continue to use some form of hybrid education. Certainly our students are very excited about going back to the in-person college experiences. And not just the students, the faculty and staff too, cannot wait to get to a basketball game. And we can't wait to get to homecoming. And we can't wait to get to in-person commencement. So, those are things that we are definitely going to do in person. And certainly labs, there are experiences that you just cannot do online. But I will say that I don't personally miss having to drive to Lansing for all my meetings, or having to drive to Detroit for all of my meetings. And a lot of those Zoom meetings that we've been doing, and a lot of synchronous and asynchronous classes. Actually, students and faculty have found can actually offer a lot of positive experiences. So I do think that we will move to some form of hybrid education, and we've learned that we can do it really quite well. So I do think that there will be a shift to retaining some of those things that we've done this way. And I think that there will be more adult students. People can actually expand their horizons. We'll be able to increase our geography. And so there are many things that I think we've been able to take from this COVID pandemic year, and we will apply them in the future, and we'll be able to do some things better. Whether you'll continue to dress with just, an upper suit and your pajamas on the bottom, and I don't know.
That's why my camera's focused up here.
Yeah, and I'm not even on camera at all.
Yeah, well, Maddy, we want to make sure we get to reader questions, but Maddy, I want to give you a chance to follow up on that, because I'm betting you have an opinion on standardized on the SATs and ACTs for your students. Is that something you would like to see go away, or you think that's a good thing?
I do think it's time for them to go away. I understand. And I just want to say, it's so refreshing hearing Dr. Pescovitz, articulate the different ways in which you really assess a student's readiness for your institution. And I know, from years of experience working in colleges and working with a student population that can show up, or they can look on paper very challenging, but really bring quite unique talents to the higher education space, that when you are able to take a deeper dive and a look at the students from a holistic perspective, you can really see so much more about their ability to succeed in a higher education space. And, I will say, I think it's time for college admissions tests to go away. I understand some of the challenge and the wariness, but I think that we have plenty of folks on our colleges and universities that are very well equipped at understanding how students can be prepared and ready for entrance, and be supported to succeed in their college education.
Thank you. Thank you. I think with that, we'll turn it over to reader questions. Is that Catherine? Are you doing that?
I am doing that. Yes.
Right.
Thank you so much, Ron. So Maddy, Dr. Pescovitz, we've had so many fantastic reader questions. So we're going to jump into them. I don't know that we'll get to them all, but we will do our best to try. Maddy, I think this is a good one for you to start off with. What are you seeing as the impact for enrollment in gap year specifically? Are you seeing anything in terms of students choosing to kind of take a year off instead of enrolling right away?
Yeah, so for students who are, traditionally disconnected, we have seen this push into the workforce, although, as we know, the workforce has not been stable and has been a challenge for them, and many of them feeling an urgency to find some way to support themselves, or if they have children, support their children, and sort of saying, okay, well, I'll take a year off, I'll take a gap year. And I'm very concerned about it, quite honestly. When we look at our students with experience in foster care, if they do not enter into post-secondary directly from high school, it takes many years for them to come back into the college system. And when we think about the loss of potential earnings and the loss of potential financial support that is available for a very short period of time for them, many of our students, are really going to come out in the end behind. And so I am very concerned about the gap year. And I think that there's ways that post-secondary institutions can really make themselves in some ways more friendly to students who do feel like they need to work or support children or maybe even other family members during this time. and not have some restrictions around having to have a full-time course load to qualify for certain types of scholarships and grants. And so that's something that within my sphere we've really been advocating for, allowing students to flex but still keeping them engaged, even if it's just for 1 or 2 classes.
Yeah, I think we had another question that I think really speaks to kind of that need for people to earn and learn. And Dr. Pescovitz, I think maybe we'll have you answer this one because I think it'll help answer the last question that Maddy just addressed. How are colleges collaborating, and are they collaborating with skilled trades training centers? So these students that maybe are thinking about taking that gap year have an opportunity to maybe earn and learn at the same time, especially since, as Maddy said, we're kind of in this huge economic crisis right now.
Yeah, well, first of all, let me just say, I happen to be the current chair of MassU, the Michigan Association of State Universities. So we try to survey, that's the 15 public universities, 4-year universities. So we do try to collaborate among the universities to survey, how we're all both approaching the pandemic and how we approach one another and collaborate. And so that's one point in terms of collaboration. The other thing that I just want to make a very important point about is the collaboration between the community colleges and the 4-year institutions, because I think it's a point that we haven't made yet in this conversation, which I think is very important. Then I'll get to the gap year question, but I just wanted to stick that in there because we have a very close relationship, and at Oakland, we work very hard on that relationship between the community colleges and the 4-year institutions. And it is really critical to a point that Maddy made earlier about credentials and how that's important, and associate degrees and 4-year colleges. And I applaud the state for making community college free and through their Frontliners Scholarship. And that also gives students sometimes the opportunity to then take a gap year after that, but we still encourage them to go on and consider getting 4-year degree at some point thereafter. And in fact, in order to further encourage that, Oakland created a really great program, Frontliners Grant Program, to encourage students to come back at some point, even if they've taken a gap year or a gap semester, but while they're earning. And so we've offered them a great scholarship that gives them, that helps to pay that off so that they can come back. And one of the reasons why I had been discouraging a gap year during the pandemic is because there was very little for them to do during the pandemic, including get work. And so I didn't think that it was the right time for them to take a gap year. But now that employment is coming back, I do think that it is a good time for them to consider that. And so one of the other things that Oakland is doing is offering debt forgiveness programs for students. And it's a good opportunity for me to mention the fact that Michigan has actually several million students who have some college, but no degree. And this is really a very important point. Because there are many students who may be missing just a single credit to get their degree. And so we are offering debt forgiveness programs for those students to come back and finish their degree, because in some cases, they may be missing just a single credit. And if they were just to come back, we will forgive their debt and allow them to complete. And that's really a win-win. It's a win for the student. It's a win for the economy. It's a win for the universities. So it's really a wonderful program. At Oakland, we call it Golden Grizzlies Graduate, but many other universities are considering similar programs. I want to applaud Wayne State for having their Warrior Wayback program. It was the first program in the state to actually have a program like that. They pioneered this program. So it's not really gap year, because one of the worries I have about some gap year programs is that sometimes that leads to some students not coming back.
If I could
Yeah,
just add to that just really quickly and say that, for many students that lack the social capital, that debt that Dr. Pescovitz is speaking about, it doesn't have to be a significant amount of money. But if you are on your own without any kind of, fallback support, something that is a couple $100s, $500 that may have been a fine or a late payment or something, can be so prohibitive to being able to come back. So having those debt forgiveness programs are really significant. And so I'm so glad to hear that. And, would just echo and say, I would love to see more institutions take up that policy.
Yeah, thanks, Maddy, for adding that in there. A question that I think you, Maddy, that you might be able to address this. I don't know, with some of your national work on these issues. Do we have any estimates of how many students have paused kind of their college work in the past year due to having poor internet access? Is there any information out there about what those impacts might be?
I don't have a number off the top of my head, though. I would be happy to do some research and come back to you with that. Over the summer, there was some push around federal legislation to address the internet gap, and recognition that, this is such a significant issue that students just, all across the country are facing. And that it's also an issue that, deeply affects our K-12 system as well. And when we're thinking about the college to career pipeline, we are not getting anybody to college if we are not getting folks to graduate high school. And if you can't get on, to complete your courses in high school because of your internet, then where are we going here with college access? So, it's a very systemic issue. And I think I'm sure that there's research being done on this, but I would not be surprised if the number is much larger than we could even estimate that it would be right now.
Sure. Dr. Pescovitz, I don't know if Oakland has, done any surveying of students, and if you could speak to it all, the impact that you've seen at Oakland on this issue.
I don't think we've done exactly that survey, so I don't want to misrepresent that. But I do see a question in the chat from Bill Moses about the transfer. Do you want me to maybe address that one?
Sure, go on ahead.
Yeah, about the transfer credits from community colleges to an articulation agreement. So, Bill, we do have Oakland, for example, has articulation agreements with all 28 community colleges in the state, and we are working very hard to have seamless transfer of credits from every one of those community colleges to Oakland, and the transfer rate is actually quite high, and so I think that it is improving, and I know that at least with respect to our university, I can't speak for the others, so I can only talk about what I know. It has been increasingly more and more successful, and one of the reasons that we created this Frontliner Scholarship for transfer from community college to four-year college is to maximize that and to encourage that, because we very much support students starting at community college and then transferring to four-year college. So I just wanted to come back to that point, because for certain students, it is absolutely appropriate to start at community college and then plan to transfer. And especially now, as there is more and more emphasis on community college, I think it is really great. And I think that increasingly we're going to see more and more collaboration between community college and four-year college. And I think it's the way to go. So having the point that Bill is making here about making sure that there is a seamless transfer is going to be a very, very important thing, in the relationships between community colleges and four-year colleges is going to be really critical. So our relationship with, frankly, all the community colleges in the state is really, really important. And that's why, again, we're creating these seamless relationships and scholarships to allow that to happen.
Yeah, thank you for kind of diving into that a little
I'm
bit.
sorry, I shifted direction, but I saw those questions there, and I see there's another comment about Oakland Community College and their relationship with us, and it is really excellent. And I see with other four-year universities as well. It's not, it's not exclusively with Oakland. I just know that we work very hard to have that relationship thrive.
Yeah, thank you, Dr. Pescovitz. I think I want to just, I know we have 5 minutes left in this conversation, and this is a little bit of a change of pace, but we had a number of pre-submitted reader questions about vaccinations. That's kind of the hot topic right now. And I'm curious if both of you would be willing to just kind of speak about what are your thoughts about requiring students to be vaccinated to attend in-person classes this fall? And, are there any populations that are going to be, negatively impacted by those requirements? Or Maddy, could you maybe speak to that a little bit, please?
Yeah, so I will defer to Dr. Pescovitz as the expert in how this actually looks in real time in campuses. What I can say for our students who experience homelessness and foster care, it's a challenge to reach these students. They may not have predictable, reliable housing where they, can plan to be day to day, week to week, or even in the same community. And so I'm very concerned about reaching these populations of students because I do believe that they're also very vulnerable. And so I am all for vaccinating students and requiring students to be vaccinated, especially if they're going to live in on-campus housing. I just want to ensure that we are able to meet the students where they are at in their communities, and really thinking about students who are parents and the challenges that they have in being able to make it to a vaccine site. I know for my husband and I, we spent about an hour and a half in line in the middle of the day to wait for our vaccine. I am very blessed and privileged to be able to do that. We don't have children, and so we didn't have to worry about childcare. I think about our students who are working non-traditional schedules, our students who have caregiver responsibilities, and how they are able to juggle all of those things. And quite honestly, our students who have been system involved, just to say it frankly, don't have the best of perspectives on public health systems, and are very wary of systems that tell them that they should have something. And often there's a history of being told and given medication that is unnecessary, that they don't fully understand, and that has adverse effects on them that they don't have support to navigate through. And so I think that for some of these more vulnerable student populations, we need to be very mindful about how we communicate the necessity of the vaccinations, but also how we meet them where they're at to ensure that they're able to get these in a timely way. I'm very concerned about them missing second shots, and I think this is a population that we're going to see a lot of. And so as we think about what vaccination process might be best for some of our vulnerable students, I think we need to really think through, from a student's perspective, what that looks like.
I mean, I don't disagree with anything that Maddy said. I think the most important thing in order to educate the students on the importance of the vaccine is to use student ambassadors who are peers, so that they can help them understand the importance. But it's unequivocal that it is the most important approach for them to be vaccinated. And so I can't equivocate on this in any way. It's not debatable. The risks of the vaccine are minimal compared to the risks of COVID infection.
Yeah, thank you. Coming from a university president and doctor. So thank you, Dr. Pescovitz and Maddy. We've got 1 minute left, so I'm going to throw it over to my colleague, Amber DeLind, to close us out for the day. Thank you, everyone. This has been an incredible conversation. I don't think that we really could have gotten to this much in an hour, but we've done it.
Absolutely. I couldn't agree more. I just want to thank our participants today, Maddy Day, Dr. Ora Hirsch Pescovitz, for participating. We truly appreciate you bringing your expertise to this conversation. I also want to thank my colleagues, Ron French and Catherine Dugal, for helping us put on this great event. Also, I want to thank all of you who have joined us today. We really appreciate participation. Want to especially thank our Bridge members who are here in the audience today. Just a reminder that we'll be posting a recording of this conversation in Bridge tomorrow. So if you want to watch again or know someone who missed it, we will be posting on bridgemi.com tomorrow so you can see the recording. Also a reminder that these lunch breaks take place every month. May's event will be announced in Bridge soon, so keep your eye on your email inbox. That is all we have for you this afternoon. Thank you again. Have a great day. Take care. Bye-bye.